about what we did. So my name is Janelle. I work at Apogee Therapy Center right across the street here. And I am not only a physical therapist assistant, but I also manage this clinic, and we just opened a second one in Greer, South Carolina. So I kind of manage both of those. And before I worked at Apogee, I was on the stroke rehab team at Mary Free Bed. So I did a lot of inpatient work, worked with a huge variety of patients, and I have a lot of experience with transfers and just how to manage interesting situations, because every person is so different from another. So you can have dressing somebody, and you have to kind of brainstorm and go through different ways of going about that. So if you look at, did anybody grab any of the papers I brought? Mine says elderly mobility and transfers. So as we're going through this, Apogee Therapy Center, it's kind of a weird name. People are always like, Apogee Therapy? Like, what do you do there? We primarily provide physical therapy services. We also provide speech therapy and nutrition therapy. And Brian mentioned diabetes. We are a diabetes certified clinic, so our nutritionists are diabetes certified, and they provide counseling, meal planning. They work with patients to kind of figure out what works best for them, and we also we offer physical therapy for the elderly. People don't really think about that, like what that means, but I think I have 4 ladies on caseload right now that are all fall risk, and that's like literally what they're coming in and getting physical therapy for. We can help retrain the balance systems and help people become more independent that way. Gait training, helping people learn how to kind of re-walk with everything going on as they age. Things change. Things change as we get older, so we help relearn those things. And we also help with fall techniques. If somebody is a fall risk, we teach people how to kind of manage that. So if an event of a fall does happen, they can hopefully avoid it by learning better reaction techniques and by learning how to fall. We actually practice falling. So it's an interesting thing, and it works really well. And also, as we get older, everything kind of slows down. Like our metabolism slows down, our muscles don't really function the same. And so that's why you see all these little old ladies who have lost all this muscle strength, and their posture starts going. We actually work on posture and helping kind of regain everything. And like a lot of the older women I see, and men, they have a lot of like muscle tightness. Just a lot of tight muscles that are causing lots of pain. So I'm going to teach you some things you can use to kind of help stretch out and work with your patients or your clients, so that hopefully they can avoid coming in and seeing me. I don't really want more patients. I'm really busy. I mean, I want people to come in if they need it, but if we can avoid back pain, and especially for you guys too, I don't want to see any of you as a patient. I want you to feel good and not have to come in and see me. So I'll teach you some transfer techniques so that hopefully we can avoid any low back injuries. So transfer is first thing on my list. Setup. If you're transferring somebody, like say we do transfers to a toilet, make sure you have your things that you're going to need right next to you. Don't like have to leave them there and walk away. That's one thing. If somebody has terrible balance and you leave them on the toilet, that's a fall risk. So you want to make sure you have everything you need right next to you. And the gait belt, I brought mine in. Do you guys use this? Does anybody use a gait belt? This is like your best friend in transfers, especially if it's somebody who just needs a little help standing up and going over to the toilet or moving. That's one thing. If it's somebody who's, I'd say, where you're doing 25% of the effort or more, you should be using a gait belt. This will not only cover your rear ends in the event of a fall, but it's also just really helpful. And it makes patients or clients feel more secure, and it makes yourself feel more secure, because there's something. If you feel like they're going to go down, you got something to hold on to. With the gait belt, can I use you as an example? if you do use it. Thank you. Arms up. You want it around the waist. Our center of gravity is right at our belly button. So you want the belt at the belly button. I'm just going to tuck this here. So right here, I can pull the gait belt out probably 4 inches. That's too loose. This is a gait belt that is too loose. It needs to be very snug. So that, yeah, she's being squeezed, but look how much control I have of her. I can toss her around all day with this. I have seen people try to transfer or walking with people. It's really tight. With a gait belt like this. If somebody goes down, this is gonna come right up and it's not gonna do anything. Also, on our little old people that don't have a lot of muscle bulk here, we have a huge system right here called the brachial plexus. It's a big old bundle of nerves that's all in there. And I've seen brachial plexus injuries from a gait belt coming up and slamming into that big old nerve bundle. So we gotta make sure we use tight gait belts. Be safe. And the next thing on here, so I love my gait belt, and if it's really tight, you're gonna already help yourself have better body mechanics. Because if somebody, go ahead, if somebody has a loose belt like this, are we?
I'm hoping that we're.
Are we on the camera?
Would somebody come check the camera and make sure it's aimed at us?
Can you see us? Do we need to scoot back a little more? Like right here? Well, that works too.
Okay.
Alright. So if the gait belt's really loose and you're helping somebody stand up, you're all ready to, like, in order to get enough leverage, your hands are in a terrible place. And tell me, is this comfortable on your back?
How much effort am I supposed to?
You're doing fine. Is this, like, look what I'm doing here. I'm like riffing on her, pulling back, trying to hoist her up.
It's not ideal.
No, and it feels uncomfortable on your back, right? It's
Yes.
kind of like cutting into you. She's like, yeah.
You guys are getting too much enjoyment out of this.
But if I have this belt really nice and snug, I already have to bend down more and get my back in a nice alignment.
What about your knees?
Knees are bent,
Okay.
just like this. You already like get in a better alignment here. How much better does that feel?
Much.
Yeah, that's a lot more comfortable. So already having a tight gait belt helps you out. We'll leave that there. Next thing, and I just said it, bent knees. I don't ever want to see somebody do this stuff. See, it's uncontrolled, it's not comfortable. That strains your low back. And like I said, I don't want any of you to have to come in because of a low back strain. It's not fun, it hurts.
And I went sideways.
Exactly, like she could have gone over it. There's just no control there. Whereas it's like a teeter-totter. If I get myself on the same plane as her, I can control it a lot more. I could turn her from here. I'm balancing everything. All right, so transfers. Yeah, I provided my business cards because there's so many different aspects to a transfer. Like a 2-person transfer is its own thing. If you're doing like supine, like laying down to sitting up, you always want to go wrap your arm underneath them and lift from there. You don't want to just grab them by the shoulders and yank them up, you know. What was that?
Or by their hands. And
Yeah, don't, no, oh my goodness, no. Not on their poor little shoulders. So I provided my business cards because I want it to be a tool for you guys to use. I want you to be able to email me and say, like, I've got somebody who had a stroke and I just don't know what to do with them. Like, if you ever have any questions, go ahead. Feel free to talk to me. I've worked with MS, spinal cord injuries, brain injuries, strokes is the majority of what I've worked with. Just general aging. So I'm an awesome tool to use. Go ahead and email me. All right, so we can be done with this. Tight gait belt, bent knees. You'll pretty much be good to go. There's a really cool website called More Cow Belt. They make really cute gait belts. This one was on Amazon for $8.
And we have a bunch in the office if anybody needs one.
Bunch in the office. You're good to go. I think you're good. So in the next section, mobility and aging. Is this still pointed down?
You're fine.
We're good. Okay. Our goal as any sort of caregiver or medical professional is to maximize somebody's independence. We don't want to help them on the downhill slide to needing to go into an assisted living facility or, just help them get worse. We want to help them stay at least at their level, if not improve a little bit. So I always say, when I'm looking at a new patient or a new situation, how can I make this easier so that they can do it themselves? Like, what is the best way to kind of modify the situation and help them get better, or at least stay at where they're at? We don't want to ever be enablers. We want to help people do their own work and get themselves ready and all that good stuff. So one thing I always saw in like a living facility or in the hospital, sometimes people would rush other people. There's not really an agenda. Like, we don't have to rush if we manage time well. So try to give people enough time to like complete their activities and make sure they're staying safe the whole time. The other thing, when you're working with somebody, especially the older we get, our brains start going too. As we get older, it starts at 30 years old. Our senses start diminishing and our brain function starts diminishing at 30. I'm still in my 20s, so I'm good, but it starts at 30 years old. So imagine if that downhill slide starts at 30, where somebody's gonna be at 80. You know, there's some 80-year-olds who, when you look at them, you would never guess they're 80, but then you look at their lifestyle too. And usually those 80-year-olds that are out driving themselves around and doing all sorts of stuff, they have a purpose and they are also using their brain a lot. They're keeping themselves active, they're doing puzzles and they're interacting with people, and they're usually the people who want to continue learning. So that's something I've learned. Not only is like physical activity good for older people, but also brain games and challenging the brain, because if the brain gets weak, the body's going to get weak, and if the brain isn't challenged, the body isn't going to get any better. So I put on here a couple things, like if you're